wanted to introduce you to our massage therapist. His name is Ramsey Hislop. He's been working with us for more than 10 years. He graduated from Clinique Concept in 2005, and he does a lot of deep tissue massage which complements the work that I do. And so I wanted to ask you a few questions, Ramsey.
Hi everyone.
What sort of clientele do you have?
The clientele that I have vary from the ages of 12 to 93.
Okay.
Variety between women and men. It's not more one than the other. It's fairly a fine line down between the two. A lot of them come because of particular issues, either low back pain, sciatica, neck problems, or headaches. Headaches is one of the things I work on as well.
Okay. And what sort of massage technique do you use?
The technique that I've learned or that I apply is the kinetic Swedish massage, which is a deep tissue massage, or it's a massage where it concentrates getting the blood flow back to the heart, eliminate the toxins from the bloodstream, and promote oxygenation of the bloodstream. At the same time, it helps with the circulatory system and helps with edema, just getting everything flowing through the body. Then the other aspect of it is, because I'm an actual masokinesiotherapist, is deep tissue massage. So it's working not just on the superficial muscles, but working on the deeper muscles in the body. And not just working on where a problem is, but trying to find out where the problem is coming from. Because just because a pain is somewhere doesn't mean that the problem is coming from that spot. It could be coming from somewhere else. So it's following the lines of the muscles to get to it. At the beginning, I don't put any oil on. It gives me a chance to really read the body, read the muscles, feel what's going on with the body. And when I do put oil, it's a hypoallergenic gel that I use. Yeah. And I don't put a lot on. Because the effect is, the worst thing is when you go to get dressed afterwards, is feeling like you're all oily and everything else. So it's to try and eliminate that, but also you get a nice friction with the skin, so you get a nice release of the adhesions, but also of not just the muscle, but of the different layers of the epidermis as well. Okay. Okay. And so you get a lot of referrals from all the other professionals that work in the clinic, the acupuncturists and myself? Yes, I think it's a very good mixture that we have, because I've always told people since I've started, and it's not my saying, it comes from somebody else, bone goes where muscle takes it, and bone will stay where muscle keeps it. So the whole goal in everything that we do is getting the muscle to release for the benefit of the client, and help them out with their well-being. And not just always seeing a chiropractor where it works to a certain degree, but there's still something that you can't get released. Working with an acupuncturist, the same thing. Working with a massage therapist. You know, if the massage therapist works on the muscle, but he doesn't work on the bone, there's a certain part that you do, but not the same as a chiropractor would. And then for the client or patient, the benefits last much longer, which just helps them out with their daily life. And you give recommendations following the massage depending on what the situation is? Yeah, a lot of times for me what I do is I'll give more a stretching recommendation. Unless you notice that there's a lot of back pain tension, then I'll give strengthening for abdominal core. And it's simple stuff where anybody can do at any time. And a lot of times it's just contracting the abdominal muscles. Because if you keep your core solid, then you get a lot less pain in your low back. It doesn't change the curvature as you're driving, as you're sitting. Because we forget that posture is not just a standing position. We sit more often than we do stand. So posture is very important in what we do and helping people out with that. And I think you give also a lot of recommendations as far as breathing techniques to know how to breathe properly through the massage, but also through your daily life. Yeah, classically we're going to be either an apical breather, which is somebody who breathes through the chest, or a belly breather. My job's not to change that on the person, because that's who you're going to be, but what you want to do is you want to enhance that for people, so that when they feel stress starting to build up, because a lot of times it's the first thing we forget to do when we have a timeline, when we're stressed with anything in life, we forget to breathe.